Many a times you hear people say health is wealth, but I'll rather put it, good health is wealth. Yes, but irrespective of how you decide to say it, the most important thing is this statement just goes far to show how important health is to man. Today, our focus will be on media coverage of the health sector. My guest is Barrister Eze. He is a media practitioner as well as a health specialist. You're welcome.
Thank you very much.
Barrister Eze is, he had practiced in the media sector, particularly print, for quite a number of years before venturing into the health sector, and he is also a nurse. So basically, our focus is media coverage of the health sector. And a wide range of key health-related issues are seeking attention. You have HIV, meningitis, hepatitis, and all of that. How well has the media been able to cover all those areas and still maintain balance?
Thank you very much. Media being an agenda-setting organization, I would rather say that they have tried quite the much they can in covering health-related issues, especially at the onset. If there's an outbreak, like we have Lassa fever or meningitis, the health media practitioners usually, in their work, bring it to the notice of the public. But the problem I have noticed over the years is the inability to follow up cases that are reported until that is addressed finally. Probably it could be institutional, maybe as a result of lack of enough manpower on the side of media organizations, not to generally assign media officers to particular issues and they follow it up from beginning till the matter is solved. So that is a gap I have personally observed. I might be wrong, but that is my observation.
Okay, aside the institutional factor, what else do you think could be responsible for it? You see that sometimes it is one very, I wouldn't want to say it's trending, but in the media, poor remuneration is one problem. And, a man who is not well paid might not be so motivated to want to do his or her job effectively. Could you say that's one of the problems?
The problems might actually be many. That is one of them, because when you don't pay a worker very well, his interest is lowered, and he diverts his attention to other means of life, especially these days that things are very, very hard. Organizations actually need to be ready and have a robust budget for media men. A situation where a journalist covers an issue of great importance, let's take for example, there's a bombing activity somewhere and it's reported effectively on the day one. On the day two, for him to go and follow up, there's no vehicle. And what do you expect him to do? In some cases, there won't be camera, because most cases, these things need to be available. Unlike other crimes where a journalist is complete. If you see a journalist, the cameraman is there, the car is there, everything he has is there. But in our own area, it's just anything anybody can talk about. So that is one problem. Poor remuneration, poor infrastructure, and working environment not being conducive, yes, for the media men to follow up cases.
All right. In a health report, moving on to the area of breastfeeding, it was stated that the federal government is set to achieve 50% of exclusive breastfeeding in 2018. How feasible is that?
Well, it is feasible if they do the normal thing. And what are those normal things? Budgeting. Okay. If there is effective budgeting and the training of officers that will actually deliver the program or the project. And the officers I mean here are the nurses and midwives. Nurses and midwives are very key in anything you call health, especially breastfeeding, because by their profession, they are 24 hours there with patients and nursing mothers from antenatal to postnatal level, until indeed death. It is said that the midwife brings you to life, and midwives equally sends you, gives you bye-bye if, the cause of dying. So if government actually wants to achieve that, the issue of budgeting is very critical. The manpower training. Then the media need to actually be involved, because it's all about advocacy and public education. The media will have to drive the message down to the people. Yes, nurses and midwives do their own during the antenatal clinic, but if the media takes it up, it will be given a wider coverage.
Okay, Nidai mentioned that he heads a department in the National Association of Nigerian Nurses and Midwives, which is why he's actually in a better position to talk about that aspect of health. And now moving on, the area of mental health, this is one aspect that does not seem to be gaining the much needed attention that it deserves. You see that a good number of youth today is indulging in some sort of drug addiction or the other. Now, what do you think the media could do to tackle this menace?
Yeah, thank you very much for that question. Issue of drug has become an international issue, and psychiatric hospitals that are in this country are poorly equipped to handle mental cases. Incidentally, that is the area where I majored as a nurse. I trained as a mental health nurse. I've equally worked in London and, as a mental health support worker. If I compare what is in UK and what we have here, we cannot compare it. The environments are different. And the use of drug there is even higher, but they have facilities to take care of victims of drug abuse. Here in the country, we move around, you see mental patients loitering in the street. Nobody cares. In a hospital where they are taken care of, drugs are hardly available enough. Even when you have prescription, you need to go out to buy. Nurses who are equally trained as mental health nurses, they are not properly equipped. So everything is just the way we do things here. And there is an area where some serious ones are kept, called asylum. It's usually in the prison. It's another prison in the prison. But it's not prison per se, because health workers go in there and doctors go in there to see them and attend to them, ensure that they take their medication, and at appropriate time they will be assessed and discharged home. And when they are discharged home, the social workers take it up to create room for socialization at their various homes. And even before they are discharged, there is what we call conjoint family therapy, where the parents of the victims are usually educated on how to manage their wives or their brothers or their sisters or their husband.
In all of this, what role is the media playing in trying to tackle this or make the youth see the risks in drug addiction?
Advocacy. The media has to be involved in advocacy, public education, public awareness campaign activities. The media has to be in the front. Like I said, the media is an agenda-setting organization. They have a role to do in all aspects of life, But like we have earlier said, lack of manpower occasionally, we don't have enough media men to cover it. And we have few freelance journalists. So many of them, we don't have them as we have them abroad, where they contribute effectively and greatly into information flow of the society. So the media has a role, advocacy, public enlightenment, consistently, and then follow up cases they have identified. And then institutions like Federal Ministry of Health, Social Development, should have in-house journalists or media men whose duty on daily basis should be to go all out and report on these issues as they arise.
Yes, yes, yes. Quite a good recommendation from Barrister Ikenna Eze. He is actually a media and health practitioner. He is a nurse with the National Association of Nigerian Nurses and Midwives, and also he has practiced in the media for a good number of years. We've been talking about media coverage of the health sector. Thank you very much for coming.
Thank you.
That's about it for the Media Review segment. I'm Eunice Johnson. The program continues after this break.